Assalamu alaikum wa rahmatullahi wa barakatuh. Today our lecture under the title Systemic Factors Influencing Eruption. In addition to the local factors, there are many systemic factors may affecting the eruption of the teeth. Objectives of this lecture. In this lecture we will talk about Down syndrome, cleidocranial dysplasia, hypothyroidism, which is of two types. The first type is the congenital hypothyroidism, and the second type is the juvenile hyperthyroidism. Also, we will talk about hypopituitarism, achondroplastic dwarfism, and other causes that may affect the eruption process. Let's begin with Down syndrome. Down syndrome or trisomy 21 syndrome is the presence of a 3-number 21 chromosome rather than the normal 2. The normal body cell contains 46 pairs of chromosomes, numbered from 1 to the number 46. In case of Down syndrome, the body cell contains 3 copies of the chromosome number 21. Down syndrome is one of the congenital anomalies in which the delayed eruption of the teeth frequently occurs. Earlier literatures referred to Down syndrome as Mongolism, but the use of this term is inappropriate and it may be insulting to the affecting families. Down syndrome occurs very early in embryonic development, possibly during the first cell division. General characteristic findings. There are many general characteristic findings aiding in the diagnosis of the Down syndrome. عموما, the diagnosis of the Down syndrome in children is not usually difficult because there are many characteristics facial patterns, beginning with small orbits and chronic inflammation of conjunctiva, upward eye slope. What do we mean by eye slope? Eye slope is the line drawn between the inner corner and the outer corner of the eye. In normal situation, this line flat. In case of Down syndrome, this line lifted upward. Depressed nasal bridge, outstanding lab ear with flat or absent helix. Many children with Down syndrome have a history of repeated respiratory tract infection. The use of antibiotic has reduced the incidence of chronic infection and has resulted in fewer deaths from infection. Mental retardation. Children with Down syndrome also have some degree of mental retardation, ranging from mild to moderate. Dental findings. The most common dental findings include the delayed eruption of the teeth. The first primary teeth may not appear until 2 years of the age, and the dentition may not be complete until 5 years of age. The eruption often follows an abnormal sequence, and some of the primary teeth may be retained until 15 years of age. Retardation in the growth of the maxilla and the mandible. If we see the first picture, we found that the maxilla and the mandible appear to be smaller than the normal in vertical and in the horizontal dimension. The face of the normal person divided into 3 heights equal in size: the upper, middle, and the lower facial heights. In patients with Down syndrome, the upper facial height was smaller, and the mid-face was small in the vertical and the horizontal dimensions. The tongue tends to be larger than the normal. The small jaws contribute to the tendency of protrusion of the tongue and the dental crowding, both of which may compromise the development of good occlusion. Also, there is a higher prevalence of periodontal disease. This condition not related only to the poor oral hygiene, but may be the result of impaired cell-mediated and humoral immunities in addition to the deficiency in the phagocytic system. The patient also complaining from higher oral colonization with Candida albicans, which is one of the most common type of the yeast affecting the oral cavity. Low dental caries susceptibility in children with Down syndrome. Although some children with low cognitive ability are unmanageable for dental procedures, most are pleasant, cheerful, affectionate, and well-behaved. They can often be managed in the dental office in a conventional manner. The possibility of reduced resistance to infection should be considered in the dental management.
Cleidocranial dysplasia. It is a rare congenital syndrome that has a dental significance, which has also been referred to as cleidocranial dystosis or osteodentin dysplasia. This condition primarily affects the development of the bone and teeth. Signs and symptoms of cleidocranial dysplasia can vary widely in severity, even within the same family. The transmission of this condition is either by the parents to a child of either gender. The disorder follows a Mendelian dominant pattern. معناها إذا كان أحد الأبوين حامل للجين والآخر سليم وغير حامل للجين، أكو احتمالية إنه 50% من الأطفال يولدون حاملين لهذا الجين ويكونون مصابين بالكليدوكرانيال ديسبليجيا، وال50% المتبقي يكونون unaffected. Cleidocranial dysplasia can also occur sporadically with no apparent hereditary influence and with no predilection for race. General characteristics: individuals with cleidocranial dysplasia usually have underdeveloped or absent collars bone, also called clavicles. As a result, their shoulders are narrow and sloping, can be brought unusually close together in front of the body, and in some cases can be made to meet in the middle of the body. The diagnosis is based on the findings of an absence of clavicles. There is also a delay in maturation of the skull bone and delay in the closing of the growth lines in humerus sutures between the bone of the skull, in addition to large spaces between bones. اللي هما الfontanelles. The fontanelles normally close in early childhood, but they may remain open through the life in people with this condition. Small sinuses, especially the frontal sinus. Dental characteristics: mandibular prognathism caused by increased mandibular lengths and short cranial bases. The maxilla tended to be short vertically but not anterior-posteriorly. The development of dentition delayed complete primary dentition at 15 years of age, resulting from delayed resorption of the deciduous teeth. Presence of the supernumerary teeth is one of the important distinguishing characteristics. Some children may have only few supernumerary teeth in the anterior region of the mouth, while others may have large number of extra teeth through the mouth. Let's see this radiograph for a child with cleidocranial dysplasia. Look to the huge number of supernumerary teeth in the upper and lower jaw, especially in the anterior segment. There is also a delay in the eruption of the permanent teeth. Even with the removal of the primary teeth and the supernumerary teeth, the eruption of the permanent dentition without orthodontic intervention is often delayed and irregular. Hypothyroidism. Before talking about the hyperthyroidism, and its effect on the eruption of the teeth, let's make a review about the thyroid gland. Thyroid gland هي endocrine gland, consists of two lobes connected by a special type of tissue called the thyroid isthmus. The thyroid gland located in front of the neck, below the Adam's apple. Thyroid gland secretes three hormones اللي هما الترايوداثايرونين T3, thyroxine T4 and the peptide hormone اللي هو الكالسيتونين. Thyroid hormones influence the metabolic rate والprotein synthesis and in children influencing the growth and development. الكالسيتونين plays a role in calcium homeostasis. Secretion of two thyroid hormones is regulated by thyroid stimulating hormone اللي هو TSH, which is secreted from the anterior pituitary gland. There are a wide range of thyroid disorders. These disorders include hyperthyroidism اللي هو excessive secretion of thyroid hormones, hypothyroidism, axial hyperthyroidism اللي هو deficient secretion of thyroid, thyroid inflammation, thyroiditis, thyroid enlargement اللي هو الجويتر, thyroid nodules, and the thyroid cancer.
Hypothyroidism is another possible cause of delayed eruption. Patients in whom the function of thyroid gland is extremely deficient have a characteristic dental findings. Hypothyroidism is of two types. The first type is the congenital hypothyroidism. The congenital hypothyroidism occurring at birth and during the period of the most rapid growth. If it is not detected or treated well, causes mental deficiency and dwarfism. In earlier medical and dental literature, the congenital hypothyroidism referred as cretinism. The congenital hypothyroidism resulted from either absence or underdevelopment of thyroid gland and insufficient levels of thyroid hormone. Today, it is routinely diagnosed and corrected at birth because of the mandatory blood screening of a newborn. General characteristic. The general characteristic of the child afflicted with the congenital hypothyroidism are the child, if inadequately treated, will appear small in size, disproportionate person with abnormally short arms and legs. The head also disproportionately large, although the trunk shows less deviation from the norm. Obesity. The dental characteristic of the child with congenital hypothyroidism include delay in the eruption of the teeth. The dentition delayed in all stages if doesn't treated, and this include the eruption of the primary teeth, the exfoliation of the primary teeth, and the eruption of the permanent teeth. The teeth are normal in size, while the jaws are small in size. This results in crowding of the teeth. The tongue also large in size and protruded. This will result in anterior open bite and flaring of the anterior teeth. Hyperplastic type of gingivitis. This type of gingivitis resulted from the tooth crowding, malocclusion, and the mouth breathing of the child.
The other type of the hypothyroidism is the juvenile hyperthyroidism, also named acquired hyperthyroidism. It is the hypothyroidism results from malfunction of thyroid gland, usually occur between the age of 6 and 12 years of age. It is the most common type of the thyroid disorder in children. Deficiency in thyroid hormone lead to many signs, include slow growth, lack of activity, and poor performance in school. In children, it is often referred to as acquired hypothyroidism. The most common cause of acquired hypothyroidism in children is an autoimmune reaction. This is when the body's immune system slowly destroys the thyroid gland. General characteristic findings. The unusual facial and body patterns characteristic of person with congenital hypothyroidism not present because the deficiency occurs after the period of the rapid growth. The obesity again evident but to a lesser degree than the congenital hypothyroidism. Dental characteristic findings. In untreated juvenile hyperthyroidism, delayed exfoliation of the primary teeth and delayed eruption of the permanent teeth are characteristic. A child with a chronologic age of 14 years may have dentition in a stage of development comparable with that of the child of 9 or 10 years of age. Hyperpituitarism. The pituitary gland is a small pea-sized gland, play a major role in regulating vital body functions and general well-being. It is referred to as the body master gland because it controls the activity of the most other hormones secreting gland. The pituitary gland consists of two lobes, the anterior lobe and the posterior lobe. There are many hormones secreting by the pituitary gland, including the growth hormone, the adrenocorticotropic hormone, thyroid stimulating hormone, luteinizing hormone, follicular stimulating hormone, and prolactin. The growth hormone deficiency resulted in deceleration of the growth of the bones and soft tissue of the body. The early diagnosis again is routine because of mandatory blood screening of a newborn. General characteristic findings. Individual with pituitary dwarfism is well proportioned but resembles a child of considerably younger chronologic age. In addition to some degree of cognitive disability. زي ما واضح بالصورة إنه هو normal لكن in smaller size. Dental characteristic findings. The dentition is essentially normal in size, but there is a delay in the eruption of the dentition. In severe cases of hypopituitarism, the primary teeth don't undergo resorption at all, but instead may be retained through the life of the person. The underlying permanent teeth continue to develop but not erupt. Extraction of the deciduous teeth is not indicated because the eruption of permanent teeth cannot be ensured. يعني من الأفضل إنه ما نسوي extraction primary teeth لأنه ما حنضمن بزوغ permanent teeth. Achondroplastic dwarfism. This is a genetic disorder whose primary feature is dwarfism. In those with this condition, the arms and the legs are short, while the torso is typical normal. Those affected have an average adult height of 131 centimeters for male and 123 centimeters for female. Other features include a large head and a prominent forehead,
The complications may include sleep apnea, recurrent ear infection, but the disorder doesn't generally affect the intelligence. This condition caused by mutation in the fibroblast growth factor, which results in this protein being overactive. This condition diagnosed at birth and demonstrate a few characteristic dental findings. It is clearly an autosomal dominant disorder, although the sporadic spontaneous mutation can occur. The condition occurs when the ages of the parent differ significantly. معناها إنه لما يكون فرق العمر بين الأب والأم كبير ممكن إنه الchild ينولدون بأكوندروبلاستيك dwarfism. In contrast to the Down syndrome, the increased age of the father may be related to the occurrence of the condition. إذا تذكرون قلنا الماترنال age بالداون سيندروم كلش مهم. كل ما زاد عمر الأم زاد الشانس إنه ينولد الطفل بالداون سيندروم. بالأكوندروبلاستيك دوارفيزم كل ما زاد عمر الأب زاد الشانس إنه الطفل ينولد بالأكوندروبلاستيك دوارفيزم. General characteristics. The growth of extremities is limited. السبب إنه there is a lack of calcification in the cartilage of the long bones. مثل ما تشوفون long bones of the arms و long bones of the legs. The head is large, but then the trunk is normal in size. اللي هو الجذع يكون normal in size. Fingers of the hand equal in length, but the hands are plump. الفونتانيال أيضا يكونون open at birth. upper face, upper height underdeveloped, while the bridge of the nose also depressed. Also, there is a deficiency in the growth of the cranial base. Dental characteristics. The maxilla may be small, with resultant crowding of the teeth and tendency for open bite. Chronic gingivitis. Chronic gingivitis not related only to the poor oral hygiene, but related to the malocclusion and the crowding of the teeth. قلنا السبب بيه إنه هو small jaw. The development of dentition was slightly delayed. يعني يكون أكو delay بس مو مثل ال other conditions. Finally, the other causes. There are many other causes related to the delay of the eruption, such as gingival fibromatosis, Gardner syndrome, and the other syndromes. Thank you for your attention.